500 Australians have joined a class action lawsuit which is seeking compensation for those allegedly injured by COVID vaccines. The landmark lawsuit has been launched against the federal government, against the TGA and the Department of Health, and alleges negligence by the TGA in its approval and monitoring of COVID-19 vaccines. The TGA refutes the claim with their safety report published on the 20th of April, revealing adverse risks are extremely low. Spearheading the case is a brave Queensland GP, Dr. Melissa McCann, and Melissa joins us now. Melissa, great to see you. This is a fascinating story for many, many reasons, but tell us how you got involved and how serious is this class action in your view?
Oh, thank you so much for having me on the show, Rowan. So how I got involved in this was really once I'd reached a point of some frustration as a general practitioner myself, seeing patients who had had severe injuries in a very short time frame after vaccines, and seeing the difficulties that they were experiencing with having those adverse events properly acknowledged and also receiving compensation for these injuries. And in many cases, these were completely life-changing injuries that required them to undertake expensive further medical tests, to be unable to work, and in some cases unable to care for themselves, so that their spouse was also out of work. And, these people really have been left for a very long period of time without any help and also without any acknowledgement because of these issues around censorship and really not being able to openly discuss what's happened to them.
Rita.
That seemed to be this climate of censorship around this issue. And I think it was really when Dr. Karen Phelps, who herself was, I would call a bit of a COVID hysteric at the time, when she came out with her experience with the COVID vaccine, that we saw so many others, people in the media saying, yes, I was also impacted, but I didn't feel like I could speak. How many people are coming to you and saying, I don't want to talk about this publicly because of the stigma that's almost attached to it?
Yeah, I've been surprised how many people have really carried the weight of not wanting to speak about this. And it's either because perhaps at first initially they were reluctant to dissuade other people from having the vaccine if they thought that perhaps they'd just been extremely unlucky. But then as the months have gone on and we're seeing more and more reports of adverse events, more and more people are hearing from others who've had these adverse events, then I think unfortunately what's then happened is that these people have been unable to speak freely because with few exceptions, and obviously thanks again to your show, but with few exceptions, really an unwillingness from the media to discuss this.
Yep.
James.
And Dr. McCann, I'm curious, who are you suing in this lawsuit? I've got here that you're suing the federal government, the TGA, and the Department of Health, but are you also going to sue the actual vaccine makers themselves, or have they got legal immunity that prevents them from being taken to task for whatever injuries their product is alleged to have caused?
So this action is not being brought against any of the vaccine manufacturers. I know that in the US, for example, there is legislation that does protect or give immunity to the vaccine manufacturers. That's called the PrEP Act in the US. We don't have that legislation in Australia, so my understanding is that people could get their own legal advice if in fact they wanted to instead sue the vaccine manufacturer, and as I understand it, there's no prohibition to doing such a thing.
So, Dr. McCann, tell us, so I'll just repeat again because it's important. These are allegations that we're going to talk about in a second, and also that the TGA have yet to file their responses to them, but their recent report says that no, they're still maintaining their position previously regarding safety. Tell us some of the alleged adverse reactions to the vaccines.
Well, the three representatives of this class action, their adverse events I can certainly talk freely about. So one is a man in his 40s named Gareth who had severe myopericarditis, and as a consequence of that had to undergo open heart surgery. It's had enormous impacts on his ability to enjoy his life, care for his family and work. The second applicant, Anthony, he suffered an extremely significant and debilitating chronic fatigue type of syndrome and neurological syndrome that has been near incapacitating and very difficult, I think, those types of reactions to live with, because there's no name for it, there's no treatment for it. We're dealing with just such uncharted waters, and yet completely and utterly life-changing for this man. And the final of the three is Antonio, and this is a man who experienced spinal cord lesions or inflammation of the spinal cord, so myelitis essentially, and was unable to walk, was bedbound for some months, had to undergo lengthy rehabilitation, and remains unable to walk unassisted.
These are severe injuries. What about other complications? We read a lot about women having their menstrual cycles impacted by the vaccine. Now, have you got many people coming to you with those sort of concerns, and is there any avenue for them, or is that not considered a severe enough issue to sue over?
No, there's a very clear definition according to the TGA and the FDA as what's considered a serious adverse event, and anything that results in a long-term change to a bodily function or requires treatment or hospital admission. All of these things, it's a much broader, I suppose, definition than what a lot of people realise. And what I can say, Rita, is I've been contacted by hundreds of people, and I think what has surprised me as time's gone on is I thought perhaps there'd come a time where there might be fewer and fewer of these really serious adverse events coming through, that perhaps people whose lives had been completely impacted would have reached out initially, and maybe that was the iceberg that we were seeing. What has been, I guess, frightening and quite distressing is that I continue to get emails daily from people with extremely severe life-changing events. So deaths, amputations, blood clots, absolutely gynecological conditions like you've mentioned. So I've not had, to put it this way, I've not had anyone who's contacted about this action who had something mild and expected, such as a sore arm or a fever. These are not the people that are, of course, seeking any sort of recompense or joining this action. These are all people who have had very serious adverse events.
And Dr. McCann, the 500 Australians have joined in the class action. You mentioned as a GP, so did you see what kind of first got you interested or raised awareness in your practice about what was happening?
Yeah, so when particularly as the mandates rolled out, so being in a rural area here, I think our community vaccination uptake was slower, I suppose, and towards the end of 21. And then coincident with that sort of September, October, November period, as the mandates were being prepared to be implemented in December in Queensland, I started to see a pattern of adverse events that I have never seen, and I've done vaccines for a very long period of time, flu vaccinations for a large majority of patients every year, and it's certainly not the norm that people would be coming in after a couple of days, one after the other, with chest pain, exertional chest pain, which is always a very worrying symptom, miscarriages, blood clots, and a very clear and obvious change to the presentations that I was seeing. That's what initially got me alerted that were we seeing something that was very different in these vaccines? They are a different vaccine platform. From there, I undertook an audit of my own practice patients. So I've been in this area for more than 10 years, and my clinic for 8 years this year. And there was certainly a change in the pattern amongst my patient cohort. And from there, I looked at the TGA DAN database, and I must say I was really quite distressed to find that in in November of 21, there was a reported death of a 14-year-old, and that young person's death remains unexplained. There were at that stage a number of young people, teenagers with cardiac arrest, at least several of them with death as a consequence of that adverse event. And the numbers statistically really don't add up that we would expect that to be coincident with a vaccine rollout like this.
Dr. Melissa McCann, that's fascinating. We will watch this court case very closely, and perhaps you'll come on again to chat to us further down the line when things start to develop in court. I reiterate again, because it's the right thing to do, that these are allegations at this stage and it is going to court, and the TGA's report says that the protective benefits of vaccine far outweigh the potential risks. Be fascinating to see what happens in your lawsuit. Thanks so much for coming on today on Outsiders, Dr. Melissa McCann. Thank you very much.